you said.
Yeah, I mean, guys,
Everything. It's like when you're answering the questions, you are hearing Dr. Lopez's voice. You are hearing this
Yes.
voice. You are this one, he said this. This one, he said that. This one, he said this.
You're so right.
Thank you.
but make no mistake, they worked really hard. Okay.
I was done
So
in an
these are
hour and a
not-
half, but I said I'm sitting back to make sure I went through everything.
Yeah, I had 1
Yeah,
hour to play
I
with.
don't want
I
to
had
make it. I don't want
extra
to
1
create
hour to
a.
play with.
Really quick, I just wanted to clarify: are we doing in class today?
Yes, we are.
Okay.
We got a little bit of time here,
Okay,
so, but we'll be starting in a second.
Just
All right, just because these are good comments, because I hate when we have someone that doesn't pass. Okay, so if you are new to the program,
people that passed already, we are clear. We are tapping from their blessing. So
thank you. Now, all right, guys. So we're about to get started, but if you are new to the program, please make sure you understand how the program works so that you benefit the most. Okay, folks. So we're about to start. So congrats, Oju.
Thank you. Thank you.
Murray and the barber. You guys are awesome. Make sure you email them so I can give you a gift. So I started giving the gift today. So today is the first day. So if you passed before, so if you still, make sure you email them because it finished today or some part of it so you guys can have it. Okay. And I know Bento.
Good luck, everybody.
Yes. Thank you, everyone. Bento, real quick, do you have a question? Marine.
Oh, hi, Dr. Lopez.
Yes.
Yeah. I'm having my exam on Thursday, and I'm still a little bit anxious.
Okay, so we'll cover that at the end, so that way we can go a little bit more detail.
Yeah,
but I
sure.
emailed you a few things to go over, and then we can clarify any of your questions at today's end of the event. Okay.
Sure. Okay.
Just keep your hands up, so that way we kind of like you can go. Oh, we can go back to you immediately after today. Last person before we get started. Dix.
Hi, Dr. Lopez.
Hello.
I'm first timer here.
Okay.
I did the pre-diagnostic test. So, and then I started,
Dix, I'm so sorry. Would you forgive me, please? But I have to get started, and then I'll go over all the other questions or not. Please keep your hands up, and then you'll be second in to go. Make sure you have your questions. Okay, folks, we're getting started now. We have lots of questions. So what I'm going to do, as always, I'm going to stay over. Any question that is in your mind, I can answer that to you. I just don't want to take away from the class. I already took a little bit, but luckily today is not a long class. But before we get started, I cannot not show you this. It is the blueprint. How do I know what is going to be on the test? I look at the blueprint. Okay, we have a blueprint. We know what's going to be on the test. And the reason why I want to show you this is everyone says my weakest point is therapy. And I say, great. That is a wonderful thing because there are only 17 questions on therapy. So where do you need to spend your focus? Modules 1, 2, and 3. That's 107 questions, right? Only need 105 out of 150. Now, one question before those folks that actually took the test, if you can please answer just this question. Did your test provide you genetic names and brain name? Yes or no? Anybody that's still there? Darn it. Usually
did, Dr. Lopes.
It did, right?
Yeah.
He did.
Okay, because someone that took the question said, oh, well, I didn't pass because she came to our program now because the test only showed genetic name. And I'm like, maybe not, right? My experience for the whatever has never changed. They should provide you genetic and brain name. Okay. Yeah. So, okay. So we're about to get started. I am so sorry. We do have quite a bit, but I wanted to show you this blueprint real quick. We know what's going to be on the test because it's right here. It's going to tell you exactly what's going to do. Clinical interview, GAD-7, Vanderbilt, PHQ-9, pediatric or psychiatric emergency, suicidal ideation, homicide, psychoeducation, recovery. How we cover this so much, recovery and resilience. You know, everything else that it's going to be on the test, we know the principles of psychotherapy, cognitive behavior therapy, interpersonal, human. They even tell you which ones. Trans-theoretical model, Lewis, right? Structural, family therapy, structural narrative, and they go on and on. Patient bills of rights, confidentiality, ANA scope, standard of practice, right? So we kind of look at this and be like, okay, what kind of questions could come from this? What is really important about sewer, dust, cows, outage? So they are telling you ahead of time what's going to be on the test. We cover all this on Module 1 Scientific Foundations last week, and today we're about to start Module 2, okay? So remember, today's event is the most important event. Why? Not because anything else, just because that's where most questions will come from, okay? So at the end of today's event, we'll go over where the question bank is, where your diagnostic test is located, how much time you should study, and how you should prepare. Because understanding your course is the #1 foundations for your success, okay? So please keep your mics muted. And at the end of today's event, I'll go ahead. What I will do is actually mute everyone. I hate doing that, but so that way we can have a good, fluid meeting. And then I'll stay back for 1, 2, 3 hours, how long it takes for you to get your answers, you know, clear and ready to go, okay? So please write it down, your questions. If you don't, you are going to forget, okay? And then tell me what topic it is, and we'll go over. First thing we kind of, for many of you, it's very clear, but we have to distinguish between the MSE versus the mini mental status examination, okay? The MSE is something that you do every time for everyone. Tons of questions on MSE and many more on the mini mental status examination, okay? So MSE, we do this for everyone. The mini mental status examination is only for those with cognitive deficit, like the population for dementia. Okay, so let's go ahead and discuss right away the MSE. Is what we use to assess the patient's functional mental status, right? And we look how they are dressed. We look their affect. We ask, what is your mood? We do a little bit of a, you know, short-term, long-term recall to test memories and attention, sometimes focus, speech, insight, judgment, and intellect. Now, my first question to you, write this down. How do you assess a 4-year-old MSE? Do you ask, hey, kiddo, what is your mood? No, right? I hope not. I mean, we could ask, but that's not, I guess we could ask that, but it's not such of a reliable measure. We observe. Question number 1, how do we assess at 4 years old? We observe. That is high yield. You need to know. We don't ask them, tell me, tell me. We can also do speech, but that wouldn't be a good observation. You know, we look how they interact with the other kids. We don't ask them about the judgment. We don't ask about insight, right? We look and observe. That is very important. Please, I know this is simplistic. All right, question number 2 and 3 and 4. You need to know the difference between thought process and thought content. And when I say need to know, I really mean it. So many folks are leaving points behind because they are getting confused between thought process and thought content. How do I know this? The same question comes up on the Kahoot, and every single time we have people missing. Okay? So if we say thought process is how a patient organize the thoughts and ideas? How are they together, independent of speech, obviously? So under thought process, we can think of tangentiality. What is tangentiality? When you ask a question and they go around and around and never answer. Board question. They will likely give you a scenario and ask which of the following thought process is most likely described. It can be word salad. It can be a different type of association. It can be circumstantiality. So if you are ever undecided in between tangentiality versus circumstantiality, it's simple. Your final answer is, did they answer the question or not? Because in circumstantiality, they will add excessive details, but eventually they answer the question. So you need to know tangentiality, they never answer the question. Circumstantiality, they go around and around and around and finally answer the question. Now, that is one way of asking about tangentiality and circumstantiality or word salad, for example. However, they could ask you, they give you a scenario because it's all about application, and ask you where would you document circumstantiality. Now, the answer could be thought process or the umbrella answer, MSE. Okay, so if they give you an example of claim association, the answer would be either thought process or MSE. Okay, so you need to know how to assess a 4 years old. What is the definition of thought process? What is the definition of tangentiality and circumstantiality? And where would you document? Another one that comes up very, very often is thought content. So this is how the patient's thoughts and ideas are put together. You know, I like to say, what are you thinking of? I'm thinking of suicidality, or I'm thinking of homicidal ideation, or I'm thinking of hallucination. They wouldn't say, I'm thinking of tangentiality, right? They wouldn't say, I'm thinking of circumstantiality, but they might say it, I am thinking of suicidality. So you need to know where suicidality, homicidal ideation, and homicidal ideation, suicidality, and hallucination is located. Where would you document that? And again, the answer can be thought content or umbrella answer. You have to be accustomed to this. Umbrella answers are very likely to be on the test. You are looking for thought content and you're like, oh man, I'm so disappointed, I don't see it. Okay, so most likely it would be MSE, one of the answer. So you need to know a little bit more. Okay, so please know this board tip. Okay, now, you know, the MMSE speech, right? The rate of speech, how the the volume, the frequency, how is the speech being said? Is it pressure speech, speaking too fast? Then you think of mania. Now, remember, since we were talking about mania, oftentimes the medication of choice is lithium, neuroprotective of choice, but it does not mean it is the one that you prescribe right away when someone is having mania. Usually, those are a little bit hotter haters medications. And what I mean by that is antipsychotics, because you want to bring the mania down kind of quick, and then you transition to lithium or Depakote and so forth. Insight and judgment, evaluating the situation or the decision-making ability, right? So insight and judgment. What is the difference? Insight is how they perceive their condition, and judgment more so what would a regular person do in the same situation. If I say, if you find a letter near a mailbox with a stamp, what would you do, right? I think a good judgment would be, I would pick it up the letter and put inside of the mailbox, right? Now, insight is more like having insight of their own situation. So that's question. How do you know someone is ready for discharge? When they take accountability for their own actions. That's when they are ready for discharge. So please write that down. When they stop blaming others and start taking accountability, gaining coping skills. But usually things with accountability, looking to the situation, having insight of their own condition, it is a way to know they're ready for discharge. So this was a quick overview. Today, we're not going to cover a whole lot because we do have, it's not a long module, but it's a lot, lots of questions will come from module 2 in general. So let me stop this recording.